This was one of the trial where the results and information are available as well. And then the Kaplan-Meier curve in a similar way, showcasing what I showed in the previous slide, where patients who received everolimus had better progression-free survival. And you can look into this information as well. And whenever you're looking into such information, you can always search as information of the trial, the name of the treatment, and patient information so that it can come in a simple language and simple information rather than going into too much of technicalities and details as if which is usually utilized by oncologists. The second one is cabozantinib, and a trial named Cabinet trial evaluated this. It included extrapancreatic neuroendocrine tumor as well as pancreatic neuroendocrine tumor as well. And it was randomized design, which means in this clinical trial, patients were either randomized two times or like two-thirds of the patients were randomized to cabozantinib. One-third received placebo, which means the placebo treatment over there, where the trial was conducted. But if those patients also progressed and had progression of disease, then they were given open-label cabozantinib as well. Primary endpoint was progression-free survival, similar to the previous trial. And in the inclusion criteria for this trial, well to moderately differentiated neuroendocrine tumors were included, which was grades 1 and 3, disease progression within 12 months prior, progression or intolerance of greater than one prior FDA-approved systemic therapy. And very important information over here was that prior therapies could also include everolimus for lung neuroendocrine tumors. That means that this patient could have directly progressed on the SSAs like lenalidomide, octreotide, or sorry, they could have not, excluding SSAs, so they could have not received any of the lenalidomide, octreotide, but they could have received one or more prior line, including everolimus. Highlighting again, exclusion was for any other SSAs before. These are some of the results from the trial. You can see over here, many patients had high-grade tumors as well, but majority of them were grade 1 and grade 2. For lung, as we're focusing this talk particularly in lung, 21% of the patients were having lung neuroendocrine tumor, those who received cabozantinib. There was concurrent SSA, which is octreotide or lenalidomide given in 62% versus 65%. And median number of systemic therapies given before was around 2. So, which means that this was given as a third line therapy after progressing on the previous line treatment. And you can see, even if this was given as a median of third line therapy, the survival was really good as compared to those who were not receiving anything, which was like placebo or a control arm. Survival for median progression-free survival was around 8.3 months as compared to placebo, which was around 13.2 months. And then the hazard ratio was around 0.45, which indicates 50% of reduction as well. These are updated results, particularly focusing on lung neuroendocrine tumors, and then primary, amongst them that the primary tumor site was lung as well as thymus as well. Histology was carcinoid, atypical carcinoid, around 67%. And then again, prior systemic therapies were everolimus, cisplatin, as well as the radionucleotide treatments as well. Similarly, prior lines were 2 for both placebo and cabozantinib. And again, similar results that the progression-free survival was significantly better, almost 8.2 months as compared to placebo of 2.7 months. And one more thing which I would like to highlight over here is radiological response. We already talked about progression-free survival. You would have heard about overall survival as well. But when we are actually evaluating how the cancer did, we look into how the radiographic response was, utilizing serial CT scan or PET scan or different kind of imaging testing for that. Stable disease mainly means that the cancer has remained stable. It can be a few percentage higher or it can be a few percentage lower in size, but it is considered as a stable disease. Partial response means that there was actually increased in treatment response, which means that the cancer really shrunk enough for calculating it as a partial response. Progression disease means that the disease has progressed, and sometimes it cannot be evaluable as well. So overall, when cabozantinib was given, you can see still higher partial response, higher stable disease, and less progressing disease as compared to placebo. Adverse events, overall any grade 3 or 4 was around 67%. with majority of them around patients having fatigue, hypertension, diarrhea, and palmar-plantar erythrodysesthesia, which can lead to some sensory symptoms problems, also sometimes have some rash as well. More important to highlight over here was also hypertension as compared to placebo, because cabozantinib is one kind of tyrosine kinase inhibitor. It's a tablet which leads to higher blood pressure as well. And therefore, blood pressure monitoring is very essential when cabozantinib is given. And therefore, conclusion was that in subgroup analysis for this particular trial, when they were given lung or thymic neuroendocrine tumor, the progression-free survival was significantly better when cabozantinib was given.